Here we are going to proceed to put a central line, a triple lumen catheter into the right subclavian vein. The landmark is marked here, that is the junction of the medial 1/3 and lateral 2/3. Junction of the lateral 2/3 and medial 1/3. This is the junction. And 1 centimeter below, or 1 finger below, that is the point of entry. Junction of the medial 1/3 and lateral 2/3 of the clavicle. Mark the point and 1 finger breadth or 1 centimeter below that junction. Infiltrate with local anesthetic agent. Dr. Deepak is performing that. Infiltrate with the local. Okay. Yes. Now he is going to introducing needle with the side port filled with the normal saline. There is no air bubble inside. The direction of the needle is towards the suprasternal notch at an angle of 30 degrees to the skin level. Gently go inside, go on aspirating and check for a free flow of blood. A free flow of blood. It is direction. Yes, he is getting a free flow of blood. This is the exact method by which you have to do a subclavian cannulation. See that there is a absolutely free flow, and look at the color of the blood. It is venous blood. Okay. Now through the side port, yes, through the side port, insert the guide wire. It is J-tipped so that injury is prevented to the vein. He is gently threading that. The first mark is gone inside. Now the second mark has come. Is introduced up to the third marking. That will be enough. That will be enough. And you can take away the cover. Stabilize the guide wire and just pull the needle outside. The remaining part is only the guide wire. Look at the ECG for any changes, and we can connect an electrode to this guide wire, and if it is the tip is in the right atrium, we will get a peaked P wave. Now Dr. Deepak is performing the dilatation of the skin entry point. Then now he is dilating with gentle rotation. Now that point has been dilated. Introduce gently over the guide wire so that the venous entry point is also dilated, so that the catheter can be easily threaded inside. Now again by rotation we can take it out, the guide wire, the dilator, Again, the remaining part is only the guide wire. Now we can thread the central venous catheter into the right subclavian vein. He has selected a triple lumen catheter. Now over the guide wire, he is gently threading that by holding the guide wire. Okay. Now the tip, he got the tip of the guide wire and holding at the tip by an assistant, Dr. Deepak is performing the threading of the triple lumen central venous catheter. Almost 13 centimeter is inside, and remove the guide wire. There must not be any air bubble inside. It must be filled, all the tubes must be filled with the normal saline. And you can see the 13 centimeter mark here. This is the 13 centimeter. That at the skin point, skin entry point, you can see the 13 centimeter mark. That much length is enough for an Indian standard, so that the tip will be at the junction of the right atrium and superior vena cava. You see there must be a free flow. He is again aspirating, and see the lumen is inside the vein, and there is a free flow of blood, and close it so that no air is being sucked inside. The patient position is little head down. Now all the lumen has to be checked properly. Look at the free flow of blood. Push it. Again close that lumen. Advantage of this triple lumen catheter is, through the central lumen we can measure the central venous pressure monitoring. Through the other lumens we can administer drugs as well as IV fluids, blood or plasma. All the lumen he has checked properly, and now he is going to fix the catheter. 2 stitches we can put after applying local, and after stitching with a transparent method or a tegaden we can fix, additional fixation can be done, and it can be kept for required dates for the management of the patient. Now Dr. Deepak has performed it very nicely, and congratulations. Thank you very much.